Removing the stigma of having sickle cell disease is one of the things that we need to really work on.
People don't choose to have a disease. Where you stay, your location shouldn't really affect your accessibility of the treatment.
When I got on the blood exchange, I didn't have the hope for it, but it made me happy. And if it's not for the blood donors, where would I be?
Sickle cell disorder is a genetic disorder that affects the structure of the hemoglobin.
The cells, they don't take up oxygen in the same way. They get very sticky blood, which can lead a patient into crisis, and they will come in with a lot of pain, struggling to breathe, and often can end up with multi-organ failure.
Most commonly, it's a skeletal pain, affects the bone, the joints, and the muscle. It can be so severe. I remember one of my patients quoting that it's just like having a toothache all over your body. One of the ways that to treat sickle cell disease is doing red cell exchange as an elective procedure. The Spectra Optia machine is the machine that we use.
So the machine will pull blood from you and exchange it for the healthy blood and give it back to you via your return line. We are removing unhealthy red blood cells and replacing them with healthy red blood cells. A top-up transfusion, which is often used as an alternative, it is simply diluting the cells rather than removing any, which can present with other problems.
I was diagnosed with sickle cells when I was 4 years old, back home in Uganda. When I was 14, that's when I got my first blood transfusion. I came to England in 2004 for university. I wasn't used to this weather. I was used to the heat, and so my sickle cell also got worse. The doctors weren't happy, so they put me on hydroxycarbamide. But it didn't really do for me what it was supposed to do. I got so tired, I got more fed up. Mentally, I was in a bad place until the blood exchange program started. And I was offered that, and I said, yes, please. It has changed my life. I've been on it since 2013. It has helped me that I don't go to hospital often. I was given that chance. I'm almost finishing my PhD, so what more do I want in life?
I was diagnosed with sickle cell disease as a baby here in the UK. Last year I had very severe leg ulcer. It got to a point it was affecting how I could care for Latifa. Latifa is my daughter, she's 3. Latifa was diagnosed with cerebral palsy, her epilepsy. I was on very strong painkillers. They make me drowsy and she likes being held a lot. So I fear if I hold her, I might just drop her. When I started the red cell exchange, it got better. It took that away, the fear that I might not be able to take care of my child.
We've been able to take the lead role at Yorkshire and Humber AHSN in a sickle cell project, which forms part of the MedTech funding mandate policy, which is an NHS England policy, trying to increase the rollout of specific innovations and technologies across the NHS, specifically with Spectra Optia. But for some reason, the uptake of that technology isn't as good as we thought it was going to be. We work very closely with specialised commissioning who fund all of the sickle cell treatment in the NHS. And we work with NHS Blood and Transplant, with the company called Terumo, who makes Spectra Optia. But then, of course, we have to involve all the clinicians. One of the things that's become quite apparent when we started the research in this area was that the automated red cell exchange wasn't really accessible across the country as it ought to be. It was patchy. So what we're finding at the moment is that in the large trusts, in large urban areas, we have quite good care. But if you have a sickle cell patient who is in more rural areas, they could find it really difficult to access the treatment that they deserve. So getting smaller hospitals, more regional access to this treatment is really important.
You should absolutely have access to this service no matter where you live, because I think it's fantastic. I think there is a perception that you have to be in crisis, you have to be really struggling. We need to get the information out there to the patients that there should be access to this service for anyone who is suffering and hopefully have really good outcomes for themselves.